Hello. Today I'm going to talk about chest pain and evaluation of chest pain. To understand that whether this chest pain is really due to any cardiac disease, heart disease, or it is due to something else. Why this is so important? Because whenever you are having chest pain, you are very much apprehended about the facts that it might be of cardiac origin. And if it is of cardiac origin, then you must visit any nearby hospital, any nearby healthcare associates, any nearby access to cardiological investigation and further management. So, as a chest pain, when someone complains of chest pain, we, the cardiologist, are worried about the facts that whether this chest pain is due to angina. Now, what is angina? Angina is basically a precordial chest pain. A precordium is the area of the chest wall which overlies your heart. So, if you are having chest pain in this area, then we are worried whether you are having angina. That means whether this chest pain is of cardiac origin or not. So, to understand this nature of the disease, you have to go through certain things like the onset of chest pain. When the chest pain first started. Second, the duration of chest pain, how long the chest pain is persisting. And third, we call it aggravating factors and relieving factors. That means how the chest pain started, why the chest pain started, what were the exact conditions where your chest pain started, and how it went off. If the chest pain did not subside, then most likely it is of severe in nature. Whether it is due to cardiac disease or any other disease, that we have to understand by several factors. First of all, if you are having a localized chest pain, localized means some patient comes with a complaint of, sir, I do have a chest pain in this particular region. So if you are having chest pain which is clearly localized, most likely you do not have any underlying cardiac disease, but we cannot be 100% sure, and that is why we need certain investigations. Second issue, the radiation of chest pain. How the chest pain is radiating. Most of the time, the chest pain of cardiac origin usually radiate from precordium, that is the chest wall overlies your heart, to the left side of your chest, maybe to the upper left arm, maybe to the back, maybe to the jaw, and sometimes to the upper abdomen. Well, this kind of radiations actually signifies that maybe the chest pain is due to cardiac origin. Third important factor is the aggravating factors and the relieving factors. How this chest pain started. What were you doing when your chest pain started? Most of the time, the cardiac origin of chest pain usually starts with any kind of exertion. You are doing any exercise, you are doing more than any ordinary activity. Sometimes it may be started with any emotional outburst, any kind of stressful situations. These are all indicative that there is a mismatch between supply and demand in the circulation of your cardiac muscles, and that is the reason you are getting chest pain whenever you are doing more than ordinary activities. Fourth important factor is the relieving factors. How this chest pain is going down. Is it persisting for a very less period of time? It is going off spontaneously, or whether you are needing any kind of medications. If the chest pain is like this, that it comes with a fixed amount of exercise, fixed amount of stress, and it goes after you take rest, then most likely this is a case of classical stable angina. So this chest pain is probably of your cardiac origin. Sometimes people take certain medications like sublingual nitroglycerin, colloquially commonly known as sorbitrate tablet. If your chest pain subsides with taking this sublingual sorbitrate tablet, then also most likely your chest pain is of cardiac origin. Sometimes your chest pain persists for more than 20 minutes with increasing in intensity, increasing in your pain sensation. That is suggestive of you may have increased degree of cardiac chest pain, cardiac origin. that we call in our term unstable angina. So these are the few facts. Whenever you are having chest pain, you must look into these factors: how it started, how it went up, if not, then what to do. Secondly, where it is located. Is it located in a particular region or it is diffuse in nature? And how did this chest pain radiate from one side to another side? Lastly, I would like to say that the chest pain we are often so worried about, usually when it is of cardiac origin, the patient, nobody can describe it properly. They say it is of heaviness in the chest. So not exactly a chest pain. So it is a heaviness in chest. We call it, it may be like compressive in nature, squeezing in nature, so that the patient often find it very difficult to have his own breath. So that is a kind of chest pain and heaviness of chest and compressing in nature and squeezing in nature that actually mandates you to visit any nearby healthcare associates, any nearby hospital, any nearby good qualified physician, and if possible to visit with a cardiologist as early as possible for further evaluation of this kind of chest pain which may be of cardiac origin. So don't ignore your chest pain. It may be of minimal in nature, it may be of severe intensity in nature. Whatever it is, you please try to analyze what it might be, but don't waste time. Go visit to any nearby qualified physician and have a proper evaluation of your chest pain so that no more complications can happen in your life and you can have a good, healthy life.